Hi, I'm Dr. Fatthi Abdel, Professor ENT, Alexandria Faculty of Medicine, Egypt, and I'm going to present on MRI in inner ear for cochlear implant, normal findings. And in this video, I'm going to concentrate on the T2 sequence. For doing cochlear implant, the MRI imaging is the imaging of choice. Why? Because it shows the cochlea, whether it's patent or not. It shows the cochlear nerve, whether it's present or hypoplastic. There are different sequences for MRI. The one of choice in cochlear implant is the T2, the heavy weighted T2 sequences in MRI. Because it shows the fluid, cochlear fluid, the intensity of the cochlear fluid as high signal intensity. And as well, it shows clearly the cochlear nerve as delineated by the fluid surrounding the nerve. So it fulfills the two parameters needed for cochlear implant. For those who are not acquainted with the MRI in brain and cochlear region, the first question is how to decide that this plate is a T2 image. The first thing to look for is the ventricle. If the ventricle is full with a high intense signal, which is CSF, this is definitely a T2 image. Another important differentiation is to look for the white matter. We know that the white matter is deep. The gray matter is outside, the white matter is inside. And the white matter, which is deep, into T2, it looks black. So these are the two main differences between T1 and T2 MRI. In other sequences which will be discussed in other videos are the reformatted parasagittal, which mainly concern with the size of the cochlear nerve. The T1 gadolinium, when you suspect the case is meningitis, especially early meningitis, and we will say why. Or if we suspect a mass lesion, vestibular schwannoma, early vestibular schwannoma. So if we have an asymmetrical hearing loss, we suspect mass lesions, we have to do a T1 with gadolinium. The diffusion weighted image in cases of cholesteatoma or in cases of cholesteatoma which have been operated and are prepared for cochlear implant, and we want to see if there are recurrence or not before going for cochlear implant, we do this diffusion weighted image, and it will be discussed in another video. And the last sequence, which will also be discussed in other videos, which is the flare technique, and this is mainly to detect demyelinating lesions, and there are other indications which will be discussed in due time. Now we have to look for the MRI T2 in axial view and coronal view. We start with the axial view. Before starting with axial view, always remember that the vestibular system is posterior superior, whereas the cochlea is anterior inferior. So in axial view, if we go from superior to inferior, superior cuts to inferior cut, we will meet first the vestibular system and then we will meet the cochlea. Starting from superior, the first structure to look for is the superior semicircular canal, and it will look at first as a line. Going a little bit inferior, the superior canal will show as two dots. Then moving a little bit down, we'll start to look for the posterior semicircular canal and a common crus. Moving more inferior, we start to see the facial nerve and the superior vestibular nerve. Remember always that the facial nerve is anterior and superior. 7 up. Remember, 7 up. So the facial nerve comes before the cochlear nerve. And as we mentioned, the vestibular system is up and the cochlea is down, so the cochlea will come later on. The facial nerve is anterior, superior vestibular nerve is posterior. Moving a little down, we will start to see the vestibule as well as the lateral canal, lateral semicircular canal, as a signet ring appearance. As we can see in all structure of the vestibular system, the fluid is high intense signal, and this is the advantage of looking with a T2 sequence. Then we can start to see the posterior semicircular canal, the other limb of the posterior semicircular canal. And now it starts to show the cochlea. Remember that the cochlea has four main parts. The inferior descending, the inferior, then the ascending limb, then the upper basal, and then the descending. So the most upward part is the upper basal. So the upper basal turn of the cochlea will show even before the middle turn and apical turn. If we move a little bit down, we can start to see the cochlear nerve anterior and the inferior vestibular nerve posterior. So the nerves again, the facial nerve superior, cochlear nerve inferior, and both vestibular nerve posterior. That of course the superior is first to show, and then the inferior will show after that. If we move down, we start to see the cochlea, which is the ascending limb and the descending limb. And then we can start to see the middle turn and the apical turn. This is the cochlea, the basal turn. And this is the last portion of the cochlea, which is the inferior basal. Also, this is the inferior basal turn, and by this it ends the axial view. Now we go to the coronal view. Again, in coronal view, remember, the vestibular system is postero-superior, the cochlea is antero-inferior. So if we go from posterior to anterior, we will start to see first the vestibular system, and then we will see the cochlea. And this is what is happening. We come now from posterior. We'll see the posterior semicircular canal first. This is the posterior semicircular canal, and then it will show the lateral semicircular canal. Remember, the lateral semicircular canal has two limbs, a posterior limb and anterior limb. The anterior limb open in the vestibule with the superior semicircular canal, the posterior limb open separately. We start to see first the posterior limb. And this is the superior canal, also the posterior limb of the superior canal open in the common crus with the posterior semicircular canal. Then the vestibule will show anteriorly. More anteriorly, we can see the lateral semicircular canal, but the anterior limb of the lateral semicircular canal. And we can see the superior semicircular canal, the anterior limb of superior semicircular canal, and each of these two canals open in the vestibule independently. In this cut, we can start to see the internal auditory canal. And we can see the nerves. The facial nerve will be more anterior. The cochlear nerve will be more anterior. What we start to see is the superior vestibular and inferior vestibular nerve. So again, the nerve, the vestibular nerve, superior and inferior, are posterior. The facial and cochlear are anterior. Facial is up, 7 up, and the cochlea is down. This is the facial nerve, and this is the cochlea, the basal turn. Moving anterior, we can start to see the basal turn as a coil, and then the middle turn will start to show, the middle and apical turn, and then the basal turn will disappear, and we will have only the apical and middle turn. I hope that I have cut the T2 sequence of MRI for cochlear implant in normal findings. It shows usually the fluid inside the cochlea as a very high signal intensity, and the nerves will show by the contrast with the fluid around delineating the nerve. And then we hope to meet in another video, and thank you.